Next witness.
Hello? Okay. I am here today speaking against AB 2336 as an Asian woman living in California and as a board member of the National Asian Pacific American Women's Forum. AB 2336 is a bill that would ban a doctor from knowingly performing a race or sex-selective abortion and would require nurses or doctors to report suspected cases. In reality, this bill is a wolf in sheep's clothing. Although it purports to support gender equity, it does the opposite. The legislative priority of those supporting AB 2336 is to take away the rights of women, not to help us. Worse, this type of bill stereotypes AAPI women. In justifying a ban on sex-selective abortion, proponents rely primarily on anti-immigrant rhetoric about the growing number of Asian immigrants to the United States and the high numbers of sex-selective abortions in Asian countries. Asian American women's organizations are already working to end son preference in culturally competent ways that, unlike this bill, are actually effective and address the root cause of the problem. This harms the health and well-being of Asian Pacific Islander women in this state, which is home to the highest number of AAPI women in the country, numbering over 5.5 million in 2010. The language of the bill criminalizes doctors, which has a chilling effect on the crucial services they provide. We do not need another barrier to health care, and making abortions harder to obtain will exacerbate our health outcomes. Bans could also force doctors to interrogate a woman and report suspected violations. This scrutiny encourages racial profiling by encouraging doctors to assume an AAPI woman is seeking an abortion solely on the basis of the sex of her fetus. This would further be exacerbated for women who experience language barriers, resulting in a denial of care. Please vote no on AB 2336. Attempting to help women by taking away women's choices makes no sense. Do not allow smokescreen language, deceptively masked as women's rights, to impede the health and health-making decisions of Asian women in this great state. Say no to stereotyping our communities. Say no to taking away our health choices. Say no to AB 2336. Thank you.